The nurses knew Margaret before they knew her father. They knew her by her Thursday arrivals. The way she came in through the side entrance near the parking structure, coat already folded over her arm, a coffee she'd stopped buying for herself somewhere around month 4 because the drives were getting expensive. They knew her by the questions she asked, which were always precise and never panicked. They knew that she had once spent 40 minutes on hold with the insurance provider while sitting in the family consultation room, and that when she finally reached a supervisor, her voice had not risen once. Room 114 had been her father's room for 11 weeks. Daniel Hargrove was 73, recently widowed, and had the specific kind of pride that made him fluent in disappointment. He'd always had opinions about Margaret, about her choices, her apartment, the man she'd left 5 years ago, whom he'd inexplicably approved of, her job in healthcare administration, which he described to neighbors as something with paperwork. He was not a cruel man in any theatrical sense. He simply had a ledger, and Margaret had never balanced it. She hadn't told him about the insurance appeals. There had been two, one in September when the provider attempted to reclassify his treatment as elective, and one in November when a billing error threatened to void the secondary coverage entirely. Margaret had written both letters herself. She knew the language. She knew which phrases carried legal weight and which ones were decorative. She had worked in the system for 14 years, and she spent those skills quietly, without announcement, the way people do when they've stopped expecting to be thanked. She also hadn't told him about the 4-hour drives. He thought she lived closer than she did. She had never corrected this impression. On a Thursday in December, she arrived to find him sitting up, which was new. The physical therapist had noted improvement. Margaret stood in the doorway for a moment before he saw her, and she watched him in the specific way you watch someone who doesn't know they're being observed. Seeing the smallness that illness gives people, the way it strips the architecture of authority down to something that just needs help reaching the water cup. Then he saw her. "You're late," he said. It was 12 minutes past 2. She came in, set her coat on the chair, traffic on the 9. He looked at the window. "Your sister called this morning." His sister, Margaret's aunt, who lived in Phoenix and had sent a card in October and called twice. "That's good," Margaret said. "She said she's been worried about me." He said it in a particular way, a way that implied the worry of others as a kind of currency, and the suggestion, never quite spoken, that Margaret's presence was administrative rather than emotional. That she came because she was responsible. That responsible and loving were not the same thing, and he knew the difference. Then he said it. "I told her you turned out to be my biggest disappointment." He wasn't looking at her when he said it. His eyes were still on the window. "I don't mean it cruelly. I just thought you'd do more with what you had." Margaret sat down. She didn't say anything for a moment. Outside the room, someone was wheeling a cart down the corridor. The fluorescent light above the sink hummed at a frequency she'd long since stopped hearing. "Okay," she said finally, not in defeat. In something more like recognition, she stayed another hour. They spoke about his physical therapy, about the medication adjustment, about Christmas. He asked if she was seeing anyone. She said no. He said she should get a dog at least. She drove home. 3 days later, Margaret received a call from the hospital's patient services coordinator, a woman named Dr. Elaine Marsh, whom Margaret had spoken with once before regarding the November billing dispute. Dr. Marsh was calling about something procedural. There was a new policy regarding insurance advocacy documentation, cases where family members had intervened formally on behalf of patients. The hospital was compiling records as part of a compliance audit, and Margaret's name had appeared twice in the appeals documentation. Standard practice now required a conversation. Margaret took the call in her car. Dr. Marsh explained that both appeals Margaret had filed, the September reclassification challenge and the November coverage dispute, had been flagged as exemplary. The September letter in particular had prevented a denial that would have left Daniel Hargrove responsible for approximately $62,000 in treatment costs. "We don't often see family advocates who understand the language the way you do," Dr. Marsh said. "I wanted to make sure you knew the outcome and to ask if we could use your letters, anonymized, as templates for our patient liaison program." Margaret said that would be fine. She asked if there was anything else. Dr. Marsh said actually yes, because Margaret's father had listed her as primary contact. Hospital policy required that Daniel Hargrove be informed of any formal advocacy actions taken on his behalf. It was a transparency requirement. Dr. Marsh had mentioned the appeals to him that morning, briefly, when reviewing his discharge planning documents. There was a pause. "How did he respond?" Margaret asked. She didn't know why she asked. "He was quiet for a while," Dr. Marsh said. "Then he asked if you were the one who'd made the calls too. I said I didn't have information about phone calls. He said, okay, that was about it." Margaret thanked her. She ended the call. She sat in the parking lot of a grocery store she hadn't gone into yet, and she watched a woman load bags into a car across the lot, methodical and unhurried. She didn't feel victorious. She felt something quieter than that, something close to the satisfaction of a number that finally balances, a column that was always correct and simply hadn't been checked. She went inside and bought groceries. She called no one.